Good morning. Today we're going to be talking about cardiovascular system with resistance training, and my name is Diamond Gower. A little history about resistance training is before 1990, American Heart Association nor the American College of Sports Medicine did not recognize resistance training as part of the guidelines for exercise training. In 1990, ACSM was the first to recognize resistance training. It was recognized as a significant component of the comprehensive fitness program for healthy adults of all ages. Resistance training is accepted as any means of developing, maintaining muscular strength, endurance power, muscular mass, and hypertrophy. Benefits chronic diseases. We're going to talk about the different planes. You have the sagittal plane, which divides the right side from the left side. It does flexion and extension, or dorsiflexion and plantar flexion, which is with the foot. Then you have the frontal plane, which divides the anterior area from the posterior area, and it does abduction and adduction. Then lastly, you have the transverse plane, divides the upper part, which is superior, and the bottom part, lower part, which is inferior. And these exercises are rotations, pronation, and supination. And as you can see here in my slideshow, I just showed you where the transfer divides from the top to the bottom. The frontal is from the anterior and posterior. And the sagittal plane, the right side from the left side. Resistance training, comparing resistance training in my research, it was comparing why resistance training was more effective than aerobic training, endurance training when coming to chronic diseases. Um, Aerobic endurance training weights higher in the development of maximizing the oxygen uptake, which is the VO2 max, associated with the coronary pulmonary variables and modifies cardiovascular. Sorry, Dr. Long, my dog knocked my camera over, but I'm going to continue from here. As I was saying, it modifies cardiovascular risk factors associated with the development of coronary artery diseases. On the other hand, resistance training offers greater development of muscular strength, the endurance, and mass, which is more beneficial to cardiac, frail, and elderly patients who benefit substantially from upper body and lower body exercises. While resistance training, aerobic and resistance training has similar effect in bone minerals density, glucose tolerance, and insulin sensitivity. Aerobic controls the weight and the calories you burn during exercise. Resistance training assists the body in expanding calories via the increase in lean body mass and basal metabolism. Thus, resistance training is strongly recommended for cardiovascular disease prevention. The benefits of resistance training. Other chronic diseases are often proven to benefit as well from the resistance training with prevention and management, such as lower back pain, osteoporosis, obesity, weight control, sarcopenia, which is the loss of skeletal mass with aging, diabetes, falls, impaired physical functions in frail and elderly persons. Those are some benefits of resistance training. The rationale of resistance training. It improves muscular strength, as we have previously stated, and endurance in men and women of all ages by from 25% to 100%, depending on training, stimulus, and initial level of strength. So with resistance training, we can go from 25% to 100% in muscular strength and endurance in all ages and in both sexes. The complementary role of stretching. Why we should stretch along with resistance training and not stretch by itself. Stretching alone has no benefits to neither muscular strength or endurance. Stretching increases tendon flexibilities and also it improves joint range of motion and function. And lastly, enhance muscular performance. But along with stretching and resistance training, flexibility exercises use systolic movements and systolic little to no movements. So the benefits of it is by adding stretching 2 to 3 days per week with resistance training, it increases muscle tendons, unit length, and results from acid myosin complex relaxation on a lasting increase, thus stretching major muscles and tendon group completing resistance training. So if you stretch before you start your training, it relaxes your tendons in your muscle, which gives you a longer lasting effect while you're exercising during the resistance training. Let's discuss some different types of resistance training. We have chest press, shoulder press, tricep extension, bicep curl, leg curls, which works out the hamstrings, pull ups, which is the upper back, the lower back extension, abdominal crunches or curl ups, um, quadricep extensions or leg press, and lastly, calf raise. These are some of the exercises that we use during resistance training. Exercise prescription for resistance training. Usually, at the least, is 2 to 3 days per week, 20 to 30 minutes per day. Repetitions for healthy younger adults ages 50 to 60 and younger, we do ranges from 8 to 12 repetitions. For cardiac patients and healthy adults over the ages of 50 to 60 years of age, we use lower relative resistance and we create more reps, 10 to 15. This is designed to prevent injuries. Things to remember when you're doing resistance training. High intensity can have adverse effects on the knees, legs extension, and shoulder rotations. So if you're using more weights, or you can cause damage to your knees when you're doing the leg extension, and then you can cause damage to your shoulders when doing shoulder press and cause damage to your rotator cuffs. Cardiac patients require a minimal amount of resistance training to perform activities associated with activities of daily living. Mild to moderate exercise is fairly well for those cardiac patients just to be able to continue those daily activities they do normally, such as washing or carrying the groceries into the house or picking up the clothes baskets to go to the washer or being able to walk to the bathroom, things of that nature. Resistance training can decrease myocardial demands during daily activity levels. Physiological considerations for resistance training. Muscle contraction has two properties. You have mechanical and then you have metabolic. Mechanical uses muscle contraction produce movement of the limbs. And then metabolic muscle contraction involves primarily the ability of oxygen for energy production and includes both aerobic and anaerobic. Aerobic is with oxygen and anaerobic is without oxygen. Let's talk a little bit about mechanical. You have isotonic movement, which includes the movement of the limbs. Concentric, which is shortening of the muscle fibers. This is the most common movement. Eccentric, lengthening of the muscle fibers, occurs when a weight is lowered against gravity. Then you have static or isometric, results from no movement of the limbs. Then we have metabolic. Let's discuss a little bit about it. There are two general types when developing exercise recommendations. Dynamic, which is aerobic, which deals with endurance. And then heavy dynamic resistance, which is anaerobics, which deals with strength. Depending on the intensity relative to the person's capability for the type of exercises, determine if activities is predominantly anaerobic or aerobic. Most physical activities involve both dynamic and static contractions and aerobic and anaerobic metabolism. Physiological response to resistance training. Dynamic, which is aerobic exercise, increases the oxygen uptake, the VO2, increases cardiac output, and can increase the heart rate. Progressive exercise increases the systolic blood pressure, maintaining or a slight decrease in the diastolic blood pressure, resulting in a containment widening of the pulse pressure. The isometric exercises, it increases heart rate and increases the blood pressure, the systolic and diastolic pressure. Nearly proportional to the force exerted relative to the greatest possible for the MVC, maximum volume. And the stroke volume is unchanged, except at a high level intensity of more than 50% of the MVC. Also, heavy dynamic resistance training, strength exercises, which involves weightlifting, for example, has a combination of responses. It occurs during both dynamic aerobic exercise and isometric exercises, reflecting a combined volume and pressure load. Level of the developed pressure load depends on the magnitude of the resistance. Smaller pressure load if resistance is not great. Smaller the pressure load if resistance is not great. Depending on duration and the intensity of resistance exercises, the heart rate increase with age predicted maximum. Heart rate can be achieved by the treadmill. Both blood pressure, both systolic and diastolic, may potentially suppress volumes during standard exercise. But diastolic blood pressure may decrease or not change with aerobic exercises and rise with resistance training. And that is all the research that I have done dealing with the cardiovascular systems and resistance training. And resistance training came out to be the best choice over aerobic exercises because resistance creates for cardiopathic patients and for other chronic diseases because it was more so to help with the prevention of injuries and to keep them with their being able to do their daily activity of lives. Not only was it helpful towards the patients who are elderly or have chronic diseases, it was an overall recommended program for all adults, healthy ages, of all ages. So thank you. I miss you and see y'all next semester.